Hey, I'm here with Gina. So, Gina, tell me a little bit about your business. How long have you been doing it? How did you get started?
Wow. So my business is digital health. And I've been in digital health space since almost 2 decades, since 2004. I am a interoperability engineer, healthcare analyst, system analyst, as well as a project manager. I started my own, and I'm a consultant as well. So I consult with various hospitals and medical universities across the United States. And I started my company, Correlate Health, which is a digital health company in 2019 with my partner, Sharon Collier.
Who is your ideal customer for your business?
My ideal customers for my business is healthcare organizations on the enterprise level, as well as patients. Population health when it comes to patients, because we also have a vested interest in building patient-facing applications and also enterprise solution for healthcare organizations.
Okay, awesome. So with the pandemic obviously disrupting, tons in the industry of healthcare, what are some things that you had to change about your business as you went through the pandemic?
Wow, we had to really pivot and really focus on, really the pandemic. And then we started focusing on population health. What type of services, web services can we utilize? Can we really venture into that will help with population health? And so we really got into data analytics. We have a platform, a Correlate platform, where we do patient data retrieval. And with that patient data retrieval, as I mentioned, some of our customers may be enterprise, but also working with private practices, providers, as well as EMS companies. And with that platform, we can also do data analytics. We can actually pull data. We have access to over 300 million patients and their data. So it's just really clinical data, diagnosis, orders, results. It's HIPAA protected, so we don't have access to who the patient is,
Sure.
but we also have access to the demographics, like where they're located. So with that, we had to pivot during the pandemic because we want to focus on population health as well. And then also clinical studies. Clinical studies is also one of our focus as well. We have access to a number of clinical studies that we are also promoting and to introduce to the, to the public as well.
Okay, great. So yeah, with that hard change during the pandemic, obviously you had to begin run things a little bit differently, change direction entirely. So do you think that's going to remain the focus of your business as you move forward?
Oh, absolutely. Yes. Population health is key. Cybersecurity, data analytics, as well as patient-facing type of applications, because it's very important as us and as patients and consumers being able to have access to our medical records at our fingertips and having specialized services. Say, for example, if you have a medical device and you want to be able to receive an alert if there's a recall on that medical device, or if there's a maintenance issue, that information the FDA now has, because manufacturers have to report that information to the FDA. So the FDA has provided APIs for digital health to be able to retrieve that information, if there's an event, if there's a recall or maintenance issue. So, building applications and services around that is very vital for patients to be able to have access to the medical records at any given time at their fingertips. So, yeah. So.
Awesome. So tell me a little bit about what's the biggest thing that you've learned since you've been in business for yourself?
Oh, wow. The biggest thing that I've learned is real patience, really. It's not an easy road. You're going to run into roadblocks. Some of the roadblocks has been my issue, has been funding. Funding has been a roadblock, but it's starting to open up, starting to meet with private equity groups, as well as family offices. we started off with, we had accredited investors, as for our seed, and we're really grateful of our investors. And as we continue to look into that avenue of raising capital as well, so that we can launch our solutions. Also, strategic partnerships. We have a number of strategic alliances and partnerships with other digital health companies that would like to align with us. And we saw that there's some synergy, and there is a handful of digital health companies that we are aligning ourselves with strategically. But, those, it's just, to me, it's always, I think, with startups and startup companies, is building that traction so that you can raise the adequate capital that you need to be able to launch your solutions.
Yeah, awesome. So along your path, both personally and professionally, who's been the best coach or mentor that you've ever had, and why?
Oh, wow. My passion and mentors. I would say my first mentor was Bill Gates. I'm a techie. I've been in technology for almost 30 years. And, I was always intrigued on how he, this operating system, that he had. And with an operating system, you have to build apps in order, on the operating system, because what's the point of having an operating system without apps? Sure. And so he not only had an operating system, a platform, but he also built applications. So now we got Microsoft Word, Excel, PowerPoint, Access, and which now everybody is utilizing his applications in some type of facet, and so I look to Bill Gates. I like Bill Gates. I like what he does. I like what he did, early on with technology, and also with his philanthropy as well. Also, Oprah Winfrey is another one, another person that I look up to as well. She bootstrapped her company, how she started, as a, her business. And then she, went on to be very successful in a media mogul. So those two are definitely my mentors. And then I can also say now I have a motivational coach. Her name is Coach Stormy Wellington. I absolutely love her. She's raw, but she's real, but she's very motivational. And she's one of my, also, one of my coaches as well, and mentors that I look to.
Awesome. Yeah, it's really important to have those people to look up to and learn from, to develop, personally and professionally.
Yes.
So you talked a little bit about the changes in your business. What do you think the future looks like as you move forward? And are there any challenges you think you'll face, as you continue on?
Yeah, but there'll always be challenges, because there'll always be room of growth. I think looking forward with my businesses, we are, I'm also a serial entrepreneur. So not only do I have my digital health company, I also have a transportation startup company as well. Awesome. And we're working with a private equity group to actually do some acquisitions, with existing non-emergency medical transportation companies. Okay. And with my transportation business, I am looking to integrate my digital health platform, patient data retrieval platform, in those businesses, because with transportation, with EMS and non-EMS, one of the problems is that having access to the patient's data during the transportation period, whether it's emergency or non-emergency, you still will, that transporter will still need that vital information, especially if there's an emergency purpose with the non-emergency transportation period. So I am looking definitely to venture more into the private equity, side of my business, but also have my digital health side of my business as well. So that's my future landscape as a serial entrepreneur, to be able to launch these platforms and to build communities around that, and then also employment. Employment is key. I would like to help families and, have an income, and then also philanthropy is key to me as well. My ultimate goal is to retire everything and become a philanthropist full time.
Awesome.
Yeah.
Yeah, that's really cool. You wouldn't, from the outside looking in, link digital health to transportation, but
Mhm.
it seems like there's a lot of synergy and overlap there.
Oh yeah, it runs hand in hand, and so we have this amazing platform, where as an NPI and national provider identifier, clinician can be able to have access to their patients' data. So with our transportation, my transportation business, and integrating my digital health platform in that business, it will give, I say clinical dispatchers to have access to medical data, patients' data during the transportation period, should they need it during that period.
Yeah.
Yeah.
Awesome. So what's inspiring you as you move forward in business today?
I always been an entrepreneur since I was a kid. I had a paper route. When I was a teenager, I had summer camp, jobs, and I've always been entrepreneur. Entrepreneurship runs in my family. So my grandmother, she had a daycare center, and it's just always been in my blood to be an entrepreneur. It was my thing was, what was my niche? Because I started and launched a lot of businesses that really wasn't my passion, but I just saw it, and I just like, well, maybe I could do that too. But I started to follow my passion, which is technology and healthcare are my passion, and helping others. And so that drives me, what I can do, how I can help other people, and the world and the community is what my passion is, what drives me.
Yeah. So with your depth of experience in different business ventures, is there any advice you would give to new business owners or business owners that are trying to scale and grow their businesses?
I think intellectual properties is key with my business. I definitely, you structure your business, having the right team. I know early on when as an entrepreneur, it was just me, myself, and I. But I had to learn that my successes has been because I have partnerships, I have a team, I have structure, meaning I have a security law attorney to help me with my, with the structure of my company. I have a partner that helps me with operations as well. And then, having advisors with my vision, structuring my vision. But also, as a entrepreneur, you want to make sure that you have your intellectual property straight. I'm talking about your trademark. You could build a brand, and that brand can end up being a multi-million-dollar brand. And if you don't own the intellectual properties of that brand, someone can turn around and serve you a stop and cease. Also, if you have a brilliant idea for a process, another intellectual property is patents, and consulting with a patent IP attorney, intellectual property attorney, to help you with filing a patent provisional and patent applications. And I think, it's just being able to be, opening up your innovations, powers to be able to just go out and just explore and galvanize your business with others to be able to help you to take you to the next level of success and accelerating your business.
Awesome. Awesome. All right. So for anyone watching the video, what's the best way that they could get in contact with you or touch base?
They can get in contact with me at ginamalak.com. Also correlatehealth.com. And then on our I said private equity side of our business, working with private equity groups as well as family offices. We have our Twin Flame Ventures.com as well, where we're doing mergers and acquisitions. So again, you can reach me at any of those websites. I have the contact information there, or you can just go directly to ginamalak.com.
Perfect. And I'll link all that in the description so it's easy to find.
Okay, thank you.
Awesome. Well, thank you so much, Gina. I really appreciate your time, and the interview was very informative.
All right, thank you, Nate. Thank you for the opportunity, to interview me and reaching out with me. LinkedIn, I'm telling you, LinkedIn is a source for me. It's been great for my network, and I'm sure for you. That's another thing I want to add for entrepreneurs getting started. Use LinkedIn as to your best of your ability to be able to network with people such as Nate and myself, because it is a wealth of information and it's very vital to your business.
Yep, absolutely.
Yeah.
Absolutely.
Yes.
Thanks again.
Okay.